community. But the homeless often take on an air of invisibility as many of us ignore them or look the other way, away from intersections and under bridges where the homeless often congregate. But the homeless come in many other forms. Many we do not see, and many who have health care needs that go unmet. And that's where Health Care for the Homeless Houston comes in. Frances Isbell is the CEO for Health Care for the Homeless. Thank you for being here. And Charlotte Garner, at some point in her life, has received the services of this organization. Thank you both for being here.
Thank you.
Thank you for having us.
Before we start talking more about what we do with your organization, what is the definition of homelessness? Because it's not just those folks we see on the corner, is it?
That's an interesting question, and it's defined in different ways by different agencies and within the federal government differently, etc. But it's basically someone who is either living on the streets, living in a place that's not meant for habitation, somebody who may be living with a family member or a friend but will have to vacate very quickly. So there's a wide kind of definition of what we mean by the homeless. So it's often not just the people that are living on the streets that we would see.
I understand. Charlotte, what was the situation that led you to seek the health care services of this organization?
Through circumstances that I experienced in my life, I became homeless. And when I did become homeless, I came to Houston from Baytown, Texas, with 32 cents in the clothes on my back. And I was shortly thereafter referred to Health Care for the Homeless Houston in the search building because I had extensive health care needs. People on the street tend to not be able to take care of their health. Their dental, their vision. And so once I got there, it proved to be a gateway for me.
To help you get back on path to do what you want to do, perhaps. I want to talk, according to a combination of a number of different organizations, I have this information from the National Alliance to End Homelessness and the HHH website. On any given day in America, there are more than 565,000 homeless people in the United States. And of those, about 15% are in the chronically homeless category, which are the ones that we tend to see. But 8% are veterans. Here locally, as you might expect, some 97% of the homeless have no health insurance, no form of health insurance of any sort, correct?
Correct. You know, it's interesting because even before I started this work, if you listen to people in the news and on the newspaper, etc., often we hear the phrase that Medicaid will take care of people, poor people with health needs. And yet there's a lot of qualifiers to that. And so most of the homeless people, a very small percentage of them are eligible for Medicaid. So there's the vast majority who have no access to health care.
What's the biggest challenge in getting services to them? To those folks, so they're out in the street, how do they find out, and how do you find out, how do you get your information to them?
Well, I mean, Charlotte would be able to tell us more, having lived this experience. But there's almost an underground sort of information swell, so that homeless people have a way often of communicating with each other.
And you said you were at Search. Was that where you went? Is that where you found out about the?
It was the Search building, yes, sir, when they were there.
And Search is, we should say, Search is an acronym for, they really care for the homeless community here in so many different ways. And so now you just opened a new building, correct?
We did.
So that's positive news. Things are going well.
It's great news. And so one of our clinics, our kind of mother clinic, used to be located within the Search building. And we have grown so much, and the need has grown so much, that we made the decision a couple of years ago to have our own standalone clinic. And we will open that clinic next Tuesday on the 9th. On Monday, we're holding an open house for homeless people and homeless service providers. This has been part of a very coordinated effort in Houston. Houston is nationally recognized right now for leading the effort in a coordinated effort to work with people who are experiencing homelessness.
And Charlotte, I know you at this point, because of the help you've had along the way, including from this organization for healthcare, that you're now studying on the way toward a degree of some sort. And now, what do you tell other people about your experiences and how they can not maybe have similar challenges to get to the next level?
Well, because we have what we call as a consumer advisory board that the board created, where they consult with formerly homeless people to see if, we have suggestions as to where the services can be improved. And it was a member of that board that led me to be proactive in joining in and giving back.
Does the homeless population that you're aware of, how familiar are they with this organization and what they provide?
It's been well reputed for many years, since prior to my entering here. But the services that they provide help in the aspect that they lift people's self-esteem, because you get a new smile, you get glasses where you can see, and then you have a better perspective, and they refer you to any type of agency that you need for all of the rest of your needs.
Well, I want to say congratulations and good luck on the opening coming up this next week. But you also have a nice little, the Heart in Harmony, that's coming up. I want to make sure we talk about that. Andy Sirota is going to be emceeing that, I understand.
That's right, he is.
That's on the February 25th from 6 to 9 at the Ecclesia Church, 1100 Elder Street in Houston. You can go to the website homeless-healthcare.org, or you can call 713-286-6122.
Correct.
So we get it all in there. You got a new building and the big event, and people can go down there and figure out ways they can help you.
It's a fun event. It really is. It's great.
Francis Bell and Charlotte Garner, thank you for coming in. Good luck going forward.
Thank you.
Thank you.
Appreciate you coming in, both of you.
Thank you very much.
Coming up, we continue to talk about just in time.